this Corona Chat, I want to talk about COVID and pregnancy. So people often wonder if being pregnant puts you at higher risk of getting COVID or higher risk of having lots of complications. And the short answer is it does not seem to be a major risk factor. So the studies that we've looked at, which are mostly out of China, but even anecdotally in other countries, we're not seeing any increased risk that a pregnant person would have a higher likelihood of getting COVID than the average population. Also, if a pregnant person does get COVID, it doesn't seem like they're having particularly more severe outcomes than somebody in the general population. So, for example, there doesn't seem to be any increase in ICU admissions or deaths amongst pregnant patients versus non-pregnant patients when it comes to COVID. So that's the good news. Now, from looking at some of the other coronaviruses we've dealt with in the past, like MERS or SARS, when people get severely ill, we do start to see an increased risk of some obstetrical outcomes, so stillbirth or preterm labor, those sorts of things. They tend to be associated with severe disease. So if a pregnant patient did get COVID and got severely ill, they may be at increased risk of some of those outcomes. But overall, the news is pretty good. The risks don't seem to be any higher than the general population. For the newborn, there's also fairly good news. There's really no evidence that it can be passed from mom to baby while the baby is still in utero or still inside. We've looked at infants born to mothers with COVID. We've looked at amniotic fluid, at breast milk, and really have not found any evidence that the virus is in any of those places. We've even looked at placentas and found that the virus doesn't seem to be present in the placenta. So an infant who is born to somebody who has COVID is likely not at any higher risk of getting COVID because of the pregnancy. That said, after they're born, there could be contact and exposures to respiratory droplets that would potentially be transmitted to the newborn. And so we are advising that for COVID positive people who are caring for a newborn, whether it's the person who is feeding them or changing their diaper, whether it's the person who carried the baby or their partner, if that person has COVID, it's important to wear a mask while you're caring for that infant and to do really good hand hygiene, and for breastfeeding to also wash the breast with soap and water before you breastfeed to try to make sure that any virus that could be sitting there gets washed away before the infant starts to feed.